The lockdown was supposed to buy us time. It was supposed to give the federal government time to ramp up their testing, contact tracing to suppress the number of infections. Well, now it's been obvious that they've squandered that time. We have let those sacrifices go in vain.
This is what a world emerging from months of lockdown looks like. While there have been setbacks, mutations, and new spikes of the coronavirus, much of Europe, Canada, Vietnam, and other countries have managed to flatten the curve. And then there's the US. For months, the US has had the most new infections and deaths worldwide. So if other governments have been able to get the disease under control, who's to blame for the failure in the United States? If you ask the governors of Texas or Florida, who's to blame for the massive increase of COVID cases in their states, they'll say,
we have seen an increase in the number of people in their 20s testing positive. They feel like they can go out without having to wear a face mask.
For these younger groups, they need to be thinking about who they're coming into contact with who may be in the more vulnerable groups.
I decided to ask an expert. Dr. Leanna Wen is an ER doctor and was the Public Health Commissioner for the City of Baltimore. What is the science saying?
Well, the numbers do say that the new surge of infections is primarily driven by young people. So, for example, back in March, the median age of infections in Florida was 65. It's now 35. There are multiple counties and parts of Texas where the average age of people with COVID-19 is in their 20s.
I got 10 calls, all of whom young people who otherwise would be excellent candidates to be able to put on ECMO. They're so sick that if they don't get put on, they don't get that support, they're probably going to die. I had 3 beds.
But I don't think that it's accurate to say that young people are to blame. If anyone is to blame, it's the Trump administration for not having the testing, contact tracing, isolation, the public health infrastructure in place so that we are in this position that we're in now.
Dr. Wen has a point, and that's why many countries have been able to reopen while flattening the curve. But the US's curve is looking like this. Mask wearing, contact tracing, and social distancing have proven effective in fighting COVID-19 elsewhere. But in the United States, people just aren't getting how important these things are. Americans, young and old, are getting a lot of contradictory advice. For example, while the governor of Texas blames young people, he initially banned Texas municipalities from making mask wearing mandatory. He eventually reversed that order. But a week later, the governor of Georgia started suing cities in his state for making mask wearing the law. And at a critical time in March, when many states were going into lockdown, the governor of Oklahoma was encouraging people to take their families out to restaurants. By the way, on July 15th, Kevin Stitt revealed that he tested positive for COVID-19. For Dr. Wen, the lack of clear communication has been a huge factor.
We know that public health hinges on public trust, and that public trust occurs when people know that they're receiving the most accurate information. People also understand that we may not have all the answers, and so it's really important to talk about here's what we do know, here's what we don't know, and here's what we're doing in the meantime. Here are the action steps that we're taking in order to safeguard people's health.
But while many countries have been leaving it to scientists or public health experts to guide the response, we've been getting a lot of this.
And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way.
Hydroxychloroquine. Right now, yeah. A couple of weeks ago, I started taking it because I think it's good. I've heard a lot of good stories.
The information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
Do you think that some of these officials are in fact to blame for some of the mixed messaging that's been getting out there?
It is not helpful for advancing the public's health when there are mixed messaging, even conflicting messaging that's coming from political officials versus public health officials.
From day one, the US has lacked a national strategy, while other countries have developed coordinated nationwide programs. The president has left individual states to come up with their own plans for fighting the pandemic. At times, this has even meant that states were bidding against each other for urgent medical supplies, even as people have been able to freely travel between different states with different levels of closure.
I know that we are 50 states and territories and we have this different model, but you know what? Other countries have their various models of governments too. Yet they've recognized that a piecemeal approach does not work. In my state of Maryland, our governor had to secure 500,000 tests from South Korea, a state negotiating directly with another country to get testing. And most absurdly of all, he had to get the National Guard to physically guard these tests to protect them from, get this, the federal government, because he didn't want the federal government to be confiscating the tests that he had to get.
And if you think that's bad, let's talk data. The total number of US cases has gone past 3 million, and more than 130,000 people have died. By the second week of July, as the world was recording around 200,000 new cases a day, 60,000 of them were in the United States. That means the US, with 4% of the world's population, is seeing more than 30% of its new cases. The president's solution?
You're going to find more people. You're going to find more cases. So I said to my people, slow the testing down, please.
But while essential workers, many of them young people, many of them people of color, have put their lives on the line during this pandemic, the president and vice president decided to hold an indoor rally, despite the warnings of health officials.
I want to remind you again that the freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States.
There are many people in the US, many millions of people who look up to President Trump as their most trusted messenger. And so he has an obligation to them and to everyone in the country to be the role model. Indoor rallies and events where there are many thousands of people gathered together, shoulder to shoulder with no social distancing, where masks are not required, that's the most dangerous type of setting. There was just a new model, for example, released that showed if everyone wears masks in the US, we could save up to 45,000 lives between now and November.
Florida has become the new global COVID epicenter. The state is seeing more daily cases than New York did during its peak infections. And while some people of all ages have been selfish,
one day we're gonna die, so might as well go out with a bang.
We can catch it here or home. Which one you rather do?
It's been kind of boring sitting in my house. I love my fiance, but there's only so much we can handle of each other.
It's the officials who went against the CDC guidelines and reopened the state early. And it's the governor who insists on kids going back to school in August.
I'm confident if you can do Home Depot, if you can do Walmart, if you can do these things, we absolutely can do the schools.
Meanwhile, President Trump makes statements like this.
We show cases, 99% of which are totally harmless.
It is simply not true that 99% of infections are harmless, as President Trump has said. It's a lie. It's just not based on fact.
And US officials can blame young people all they want. But the truth is, this has been a public health disaster. As European countries move to reopen, the EU has barred Americans from traveling there. Canada and Mexico are doing the same. At this critical juncture, if you could give this nation's leadership some key advice, what would it be?
3 things. One is we must have a national coordinated strategy. It's long past time for us to do that. Second, we need clear, consistent messaging from everyone. The messaging cannot be contradictory. And the third, we cannot wait. This is a disease that's already claimed 130,000 lives. We know that we're having now 60,000 new infections in the US every day, which is triple what it was just a few weeks ago. There is no more time to wait, and really we need to focus on saving lives.